Hi, my name is Diana Cervantes with the University of North Texas Health Science Center in Fort Worth, Texas. I'm also the creator of ICARE, Infection Control, Advocate, and Resident Education. I want to give you a short introduction to the ICARE program and how the ICARE program can help you better protect the overall well-being and rights of nursing home residents.
So why is preventing infections important? The COVID-19 pandemic highlighted that infections can easily spread in a nursing home, causing illness, serious health complications, and death. However, how well the spread of infections is prevented and controlled in a nursing home community is also important because it is an indicator of the overall quality of care provided there. When a nursing home successfully prevents and controls infections and diseases in residents, staff, visitors, and anyone else who provides services to the nursing home, it shows its commitment to continuously monitoring and improving the quality of care provided to residents. And when nursing homes provide high-quality care, they place residents as the focus and priority, the center of care. This is called person-centered care. Person-centered care in a nursing home community is a commitment to delivering care that respects and responds to residents' rights, goals, values, and preferences, and by doing so, empowers residents to be active and engaged in their care. When person-centered care is practiced in a nursing home community, then the overall culture of the nursing home community promotes change to a community where residents, families, and staff are equally empowered and engaged to work together to create a home environment where people are happy to work and live. The main point is that the actions taken to prevent infections can play a major role in creating a home environment where residents are the focus and the people closest to them, including family and staff, are empowered and content as a community. You may be wondering if you can make a difference in creating a culture in your nursing home community so that the focus remains on the resident, empower staff, and everyone is engaged to deliver high-quality care. Or maybe you're wondering why you should get involved. This seems like a big task that will take a lot of time. Well, it is a big task, and it will take some time. It's important for you as a nursing home resident or someone close to a resident to know that quality care, including infection prevention and control, is not just a need but a right. Yes, nursing homes provide a place for people to live. This is a need. However, those living in a nursing home have the right to live in a safe place that is clean and safe from harm. When you start to see things like preventing and spreading infection as a right and not just a need, you can see how one person can start to make a difference in protecting their rights and those of others. While this takes commitment and time, your rights and other residents' rights are very important and worth every step to ensure those rights. So what can you do as a nursing home resident, family member, or someone close to a nursing home resident to prevent infections and promote high-quality care, helping to create a home and community? You can take small but very important steps, beginning with learning about quality care. That includes learning basic information about preventing and controlling infections, how this helps to provide high-quality care, and who in the nursing home community contributes to making high-quality care happen. With this new knowledge, you can discover how quality care is provided. So, how are infections controlled and prevented in your nursing home? And what is done in your nursing home to ensure the quality of care, including infection prevention and control, that it's maintained and improved as needed? Lastly, you can work with residents, family members, staff, and administration to plan and improve the quality of controlling and preventing infections in your nursing home. And making sure your plan is ongoing, progressing to higher quality care, recognizing that nothing is perfect, there are no perfect plans or perfect people, but there must always be a way to work towards recognizing where improvement is needed and having a plan to improve the quality of care in the nursing home. This brings us back to the ICARE program, which stands for Infection Control Advocate and Resident Education. The ICARE program starts with basic education on infection prevention and control and residents' rights, providing you with knowledge on preventing and controlling infections in a nursing home community and how these practices safeguard residents' rights and contribute to the overall quality of care in your nursing home community. But we know that learning something doesn't really stick and create change unless we apply it. Step 1 of ICARE begins with basic education. However, the real change happens when you discuss and apply the information in the lessons to your own situation. With the collaborative support of the Long-Term Care Ombudsman, who is an independent nursing home advocate, you and those closest to you can become engaged in understanding how quality care is maintained and improved. This is step 2. In step 3, the power of collaboration comes into play. You, those closest to you, and the nursing home staff and administration are empowered to work together to identify barriers to providing the highest quality care and take steps to improve and monitor care quality. So, ICARE is not just a program. It's a platform for change where everyone in a nursing home community works together in small, progressive steps to make positive change. It incorporates education and engagement and emphasizes the empowerment of nursing home residents and their advocates. Remember, even the smallest step can significantly improve care quality. You can begin the ICARE program by taking the first step and learning about the basics of preventing and controlling infections and how infection prevention ties into quality care and protecting resident rights. 7 short lessons, about 20 minutes or less in length, are available online or can be delivered in person at your resident or family council meeting. These lessons include common infections in nursing homes, preventing infections in nursing homes, safeguarding the nursing home environment, hand hygiene heroes, gowns, gloves, and goggles, less antibiotics, more vaccines, and nursing home response, outbreaks, and other emergencies. As you go through the educational lessons, your nursing home ombudsman, administrator, and staff will help you become engaged in understanding what steps are taken in your nursing home community to provide quality care, and then become empowered to collaborate with those in the nursing home community to take action to improve quality care, starting with infection prevention and control. Now you can see how the ICARE program can help you make a difference in creating a nursing home community that focuses on the residents, empowers staff, and engages everyone in quality care. You should definitely get involved because every step you take to understand and apply quality care in your nursing home community isn't just something that provides a need for nursing home residents, it's a right that we must all work together to protect for ourselves and others who cannot do so.
Thank you so much for taking time to learn about the ICARE program. For additional information, please visit the ICARE website below. If you have any additional questions, please feel free to send me an email at icare@unthse.edu.